This segment is sponsored by Golden Triangle Internal Medicine and Geriatrics.
Good evening, Southeast Texas. Thank you for joining me for another edition of Ask the Doc. This is Dr. Levine of Golden Triangle Internal Medicine and Geriatrics. We do have one question for today. So I did get the COVID-19 vaccine, but there's rumors out there that these patients are not having immunity when their antibodies are checked. Is that true or is that false? Well, you know, we seem to have a lot of questions about these vaccines, and honestly, I wouldn't know the answer to that. As far as I know, again, we're still not recommending anybody get antibody tested just in general. We still just don't know what to do with the test. And most of these antibody tests really don't have levels. They really just have a quantitative quality result to it, which is either positive or negative. So they're not really giving an actual number to the number of antibodies you've made. And that's been the big question with the scientists all along is, how much of an antibody load do you need to actually offer protection? And depending on the load you have, does that give you 6 months? Does that give you a year? We just don't know the answer to that. This virus is still in its infancy when we talk about other viruses that we've been dealing with, such as the flu or other viruses that have caused gastrointestinal and upper respiratory infections for a long time. It's still in its infancy. We probably won't know those answers for several more years as we study this. But the main idea actually is to get your vaccine. Try not to worry about those sorts of questions at this point. The main thing is getting it so that we can get herd immunity up and going so that we can flatten this curve and get over this pandemic and get back to the life we once knew. And I know that's what we all want. And that's really the main thing that I would recommend. At this point in time, it's really unclear as to what that means. If you have any other questions on Ask the Doc, give us a call. We'll see you next week.